Hello, everyone. In this unit, we're going to talk about psychological disorders and their treatments. So we're going to start off with asking the question, what is a psychological disorder? So the term psychopathology literally means like a sickness or a disorder of the mind. But drawing a line between what is kind of normal or abnormal when we're talking about something like behaviors isn't really a very clear cut thing. You know, we all feel sad or anxious sometimes, and those feelings, just feeling those things, is not any type of disorder. When we talk about a psychological disorder, we're talking about something that is diagnosed when someone experiences significant distress or impairment in their daily lives and something that persists over time. So this is not about just being odd or feeling bad for a day or two. You know, someone can be anxious so that they can be so anxious they can't leave the house for weeks, or they're so depressed that they can't get out of bed. And so these are signs of something that is more serious than someone simply feeling nervous or feeling sad. So there's a lot of different ways that you can kind of conceptualize talking about psychological disorders. And so one of these ways is the diathesis stress model. And this is a way that people can explain why some people develop a psychological disorder and some don't. So this model proposes that people have varying levels of vulnerabilities, or or they develop different levels of vulnerabilities in how they develop a psychological disorder. So this vulnerability can be something like a genetic background, or something that's a family history of, say, something like depression. Now, just because that they maybe have this vulnerability doesn't mean that someone will develop a disorder. According to this kind of model, it's that when you have this vulnerability and it gets combined with certain types of stressful life events, maybe someone loses a job, there's a relationship ends, or something, that then the disorder might emerge. And so basically it's kind of the idea of the interaction between nature and nurture, that you have this diathesis, that's this, kind of nature that interacts with the nurture part, the stress that happens, and then that determines whether or not you would develop a psychological disorder. The biopsychosocial approach goes kind of even further in explaining that psychological disorders are rarely caused by any kind of single factor. Instead, they emerge as a mix of different things, and so we have biological factors. So these are things like genetics or brain chemistry, and or even interesting. There's this kind of growing evidence about your microbe in your gut. So you have all these kind of bacteria that are living in your digestive system, and there's actually evidence that links their role in things like maybe like depression or schizophrenia or whatnot. And it's a growing area of research. In some other classes, I have students read papers on this, but it's really kind of fascinating that for all of our emphasis on the brain and in brain chemistry and psychological disorders, there could be this whole other thing in the gut that maybe has a role in psychological disorders. Other factors that go into this are psychological factors. So these are your emotions, your personality traits, your learned experiences. So, if someone has a tendency to interpret every mistake as evidence that they're a failure, this might make them, say, more vulnerable to depression. Another aspect that we have to be mindful are the social cultural factors. So these are things like family dynamics, economic hardship, cultural expectations. So, you can, all these things that go on in our culture and society can then affect how we respond to things. And that all combines together with the biological, with the psychological, all those things kind of go together to then put a person at risk for psychological disorders. Now, when somebody seeks help from a psychologist, one of the first things that they're going to do is they're going to do a psychological assessment. And this is a way for them to understand a person's symptoms, experience, and behaviors to determine whether or not there is a psychological disorder. And so this can take the form of different things that they might do. For instance, they might start with a clinical interview. And so this is where the person kind of talks about their thoughts and their feelings and their experiences, and goes into them understanding where the person is coming from. You could have certain kind of self-report data. They might have you fill out measures that help them to kind of understand what's going on. They might observe your behaviors. Even just sitting there in their office, they're going to be able to see behaviors that you're exhibiting. And then they might have more specific psychological testing. These kind of standardized tests are ways for them to measure symptoms in a more objective way. There's a lot of different forms of this kind of psychological testing, but they can kind of put through these objective tests that they put you through, the observations, the self-report data that you give, and their clinical interview that helps them to determine whether or not you maybe have a psychological disorder. And then if so, what type of treatments would then be best for you. And then in ideal circumstances, then there is ongoing testing. So measurement-based care, where they are periodically assessing you through the therapy process so they can see whether or not you are benefiting or whether there needs to be changes in the therapeutic approach that they're using. So what counts as a psychological disorder? We've had, this idea over the years of, older times they would have, said that somebody who is acting bizarre or mad or something, that this is, that this was spirits or witches or something like that are, have possessed a person or what have you. But today we have this kind of idea that we want to have these categories that we can use for diagnosis. But it's important that these categories are accepted categories so that when clinicians are talking with each other, they're using the same language. If someone says that you are depressed, then that needs to mean something to different clinicians that you're working with. This diagnosis, they know where that diagnosis comes from. So having a shared vocabulary helps to have increased care. So the American Psychiatric Association in the 50s developed something known as the Diagnostic and Statistic Manual of Mental Disorder. And we call this the DSM. So the current version of this is the 5th edition text revision. So you see it written as the DSM-5 TR. And so this is the guidebook that clinicians use when they are trying to categorize a psychological disorder. And there are hundreds of disorders that are described, and they're described in terms of observable symptoms. You know, that it's always a little tricky when we're talking about psychological disorders, that this isn't something that we can, do a blood test on. Usually you can't do some kind of neuroimaging or something like that. So we need some way to still objectively measure these things. And we do this on these observable symptoms. So a diagnosis then is then based on if a person meets a specific set of criteria. And they're not, just kind of like vague thing. The psychologist goes, this person seems depressed. That they actually have these very specific category or symptoms that you must meet 3 of 5 of these symptoms over a several month period. Like they have these very precise things about what the person meets. And they are developed through years of clinical research. So they put together committees on this. They have researchers and clinicians and patients who all come together and work on this. And they work through these different revisions. As you can see, that we're on the 5th edition now. And this has been going on since the 50s, that they keep revising these and updating the categories and the symptoms based on the latest research. It's organized together so that kind of related disorders are grouped together. And then it even includes, like in the third part of the DSM, are things that may become recognized disorders. So things that are not yet officially recognized as a disorder, but things that are kind of emerging. And this is meant to be kind of like, this is where the new research should go toward to see whether or not we really should use this as a disorder in the future. Now, one thing that really should kind of be mentioned is that the DSM takes this categorical approach. So you meet criteria for having a psychological disorder, or you don't meet this criteria. Some people, though, argue that we should have kind of a more dimensional approach, that instead of there being this, like you have this or you don't, that really these kind of symptoms exist on a continuum. And so, in this image here, it's that anxiety maybe that you have, from being a slightly anxious person to being a very anxious person. And that someone might fall in the A category or the B or the C or somewhere in between, as opposed to saying this person has an anxiety disorder, this person does not have an anxiety disorder. And so, this perspective can help us kind of understand the complexity of mental health, because it's not always black and white when we're dealing with that. Another really important thing to kind of understand is the idea of comorbidity, that people don't always fit neatly in a particular category. And that, so when someone meets criteria for one psychological disorder, they actually might meet the criteria for other psychological disorders at the same time. A really good example of this is depression and anxiety, that they often kind of go hand in hand. And so, or you might see a person who has PTSD who also is struggling with a substance use disorder. And so when we recognize these kind of comorbidities, that helps clinicians to treat, the whole person, as opposed to just focusing on like trying to fix a certain set of symptoms.